Assalamu alaikum. My name is Rauf Nadir. I'm a third year medical student at Ahfad University and I'll be your doctor for today. Can you please tell me your full name and age, please?
I'm Basma Mahmoud, 20 years old.
Okay, Basma. Today I'll measure your blood pressure. This involves inflating the cuff on your upper arm, feeling and listening to your pulse. Is that okay with you?
Yes.
Wash my hands and ask the patient to expose both of our arms. Before we start, I should make sure that there's good privacy, warm room temperature, and my equipments are here, which are a sphygmomanometer and a stethoscope. I should make sure that the sphygmomanometer is on, the cuff is deflated, and the air pump is closed. I should make sure that the patient is comfortable and relaxed, and I should choose the arm with the easily palpable brachial pulsation. Can you please give me your hands?
Sure.
Okay, I found that it's easily palpable here. The hand should be at the level of the heart, so can you please put your hand on the table?
Yes.
This cuff is the appropriate size for this patient. I'll place the cuff 2 fingers above the brachial pulsation. Can you please expose your hand more?
Sure.
Place the cuff 2 fingers above the brachial pulsation. The word artery should be at the level of the brachial artery. I should make sure that the earbuds are facing the patient and the diaphragm is open. I'll place my index and middle finger on the radial pulsation. I'll start to inflate the cuff until I can no longer feel the radial pulsation. I can no longer feel the radial pulsation, so I'll add 20 mm mercury. I'll place the diaphragm on the brachial artery and start deflating the cuff. While I was deflating the cuff, the first sound that I heard is called the systolic and the last sound that I heard is called the diastolic. Therefore, the patient's blood pressure was found to be 130/70, which is in the normal range. Before I finish, I need to tell you something that you need for this examination. There's something called the corticoff sounds. Corticoff 1 represents the systolic, corticoff 5 represents the diastolic, corticoff 4 represents the changing beats. I'm going to tell you the normal ranges. For the systolic, it's from 100 to 140. For diastolic, from 60 to 90. In general, the normal blood pressure is 120/80 mm mercury. As for children, I should use the centile chart. I have to thank my patient.